In your morning medical news, is your child's mattress secretly making them sick? A new University of Toronto study found toxic chemicals in children's mattresses that release into the air during sleep. Researchers say a child's weight and body heat cause these chemicals to become airborne, where they're easily inhaled. These toxins have been linked to early puberty, asthma, heart problems, and even cancer. Pharmaceutical giant Pfizer is abandoning its experimental weight loss pill. The company halted development after a study participant suffered a liver injury potentially linked to the drug. This marks Pfizer's second failed attempt to enter the lucrative weight loss market. Many drug makers are racing to develop weight loss pills following the massive success of injectables like Ozempic. It is a leading cause of death for children in this country. The CDC says every year there are about 4,000 fatal unintentional drownings, but health experts say these tragedies can be prevented. Mandy Gaither speaks with a pediatric emergency medicine physician about how to keep kids safe in the water.
It can happen in an instant. Experts say drownings are often quick and silent without even a single splash.
As a pediatric ER doctor, we see drownings come in very frequently during the summer and when swim season starts.
That's why Dr. Sarah Lazarus with Children's Healthcare of Atlanta says it's so important to make water safety a priority. Whether children or teens are swimming in a pool or at a beach, drowning is preventable.
Every time I hear it happens so quickly, a parent may just turn their back, and when they turn around, their child is underwater.
Lazarus says if your child can't swim 2 lengths of the pool without assistance, parents should be within arm's reach of the child at all times. Once the child is a competent swimmer and can go to pool lengths without stopping, parents can graduate to eyes reach supervision, always keeping an eye on the child in the water. She says it's also important to avoid distractions and to make sure there's a 4-sided self-latching fence around any pool you visit. A Coast Guard approved life jacket should also be worn, especially in open water. And if a parent can't swim, Lazarus says it's never too late to learn.
Remember, because you are your child's best lifeguard, it's so important that you also have those swim skills.
Yes, very important all around. And Dr. Lazarus also says you should also know how to do CPR in case there's an emergency. She says at the start of swim season, it's also a good idea to recheck your child's competence in the water to make sure their skills haven't waned since some time off last year. And Minnesota's Governor Tim Walz is getting a first-hand look at Mayo Clinic's massive expansion project. The governor and lawmakers touring the demolition site in Rochester, where a new patient care facility will soon be built. This marks the first phase of Mayo's bold Forward Unbound expansion plan. The state invested $5 billion into the project back in 2023, aiming to cement Rochester as a world-class medical destination.
We're getting the payback in terms of improving people's lives that is pretty profound. So it's a very Minnesota thing. It takes some courage and some risk, and the legislators here put that money up with Destination Medical Center. They continue to focus on training and the jobs that are necessary.
It's expected to create jobs in the construction industry over the next several years, while also increasing healthcare jobs once work wraps up in 2030.